Hello, everyone. This is Mark Anthony with Great Minds of Today podcast. We have a special guest today. And the reason why I say special, we're going to be connecting with Dr. Cindy too. And the beautiful thing about Dr. Cindy is that she is out of Plano, Texas. So if you're in a cold area, come on down and get that body tuned up. You can find her at artisanpain.com. artisanpain.com. I keep wanting to say artesian. Yeah, it's got to be the Asian in me. I tell you, I do have some Korean. So, so that's ARTISAN pain.com in Plano, Texas. Dr. Cindy is a double board certified physician in medicine and rehabilitation in pain medicine. And she's also the founder of Artisan Interventional Pain, and also a new independent practice opening soon in Plano, Texas. And I'm excited because we love to bring people to tell their story of how they started their business, but also people that are young entrepreneurs they have that beautiful young mind. And we have a beautiful Dr. Cindy here to tell us today a little bit about her story of becoming a doctor and her also opening up her practice. So thank you so much, Dr. Cindy, for being here.
Appreciate that very much.
Yeah, tell us your story, how you kind of began and why this is your passion and about you opening up this new practice, which we can tell you've got some stuff right behind you. So we know that we're not open yet. We'll be opening soon, I believe in October.
Well, to be honest, this is my home office and I haven't set up anything. I just moved to Plano a few days ago, actually.
Wow.
So in the trenches of moving, but at the same time, going out of town for a week for a trip that was planned years ago. So, such is life, but
yeah, let's keep moving.
Yeah. But yeah, I apologize for the mess. But anyway, yeah, just like you were saying, I'm Dr. Cindy too. I'm a double board certified physician in physical medicine and rehabilitation and pain medicine. And I'm the founder of Artisan Interventional Pain in Plano, Texas. And, this is a new practice that I'm building, and it's something that I've always envisioned ever since I was even in residency. And I'm only 2 years out of fellowship. So starting this practice was a pretty big leap of faith. So, but like I said, I've always had a vision of how I wanted to practice medicine and how I wanted to treat patients. And so it just felt like the right thing. And my background is in rehabilitation and pain medicine. So the way I like to approach patients and medicine in general is from a point of function. So instead of asking you, like, how can I bring your pain scores down? I truly am trying to understand, first of all, what is your pain preventing you from doing, and how can we get you back from doing that? Yeah. And outside of medicine, I love to be physically active. I know Mark and we both shared interest in playing tennis. And then, I like to do fitness racing and long distance things and everything, Pilates and kind of stuff. So I like to find conservative ways to treat patients, but then I have all the training needed for more advanced treatments if those are not working as well, including like minimally invasive procedures and surgeries and things like that.
That's awesome. So, so again, you're just building this new practice. This is your first time. I'm sure you're excited at the same time, but also at the same time, like, wow, I got a lot going on. Tell us a little bit about that and maybe the process and when you're going to be starting and what not just what you do, but the type of people that you're helping and that you've been trained in.
Okay, that's a lot of different questions. So
you're funny. You're like, whoa, I'll give you 4 more, Mark.
Well, first of all, what led me to this point now in my career is, like I said, I finished my interventional pain fellowship 2 years ago. I did my medical school and residency in the Dallas-Fort Worth area. And then I went off to Cleveland, Ohio for a year for fellowship and then was looking for work at the time. So the 2 years that I was out of training, I was in private practice as an employed physician. And that, being employed is fine, but I think Mark Cuban said this. He's like, I'm the worst employee because I always think I can do something better or want to have solutions for things, but don't have control. And so in a way, I kind of felt like that. I put my head down and I work and I do good work, but I didn't feel like I had the freedom to really treat patients the way that I envisioned treating them. But I did have a lot of good experience by being employed to get me to this point. So at least in that regard, there's that. As far as the type of patients I treat, I really have like three main archetypes, I call them. Like the number one patient is, the classic bread and butter would be maybe somebody that's a weekend warrior, or someone that like strained their back or herniated a disc and had a sciatica down their leg. I can give them a shot, an epidural steroid injection or something. They have things like that to help them get back to their lives. And that's also where the regenerative medicine comes in, which is the shockwave and the PRP that we will offer at Artisan. The second one is your Medicare patients, your elderly patients that have chronic pain, arthritis. So that's the second main group. So, low back pain that's there, or just arthritis in the knees, shoulders, everything. And then the third is like those patients that have chronic pain for years, and they've seen multiple providers and doctors, specialists, and no one seems to know what's going on, and no one has really answers for them. Those are the complex patients that the other type of patients that can see, like I said, on the specialist in pain and in rehab. So I can really try to find ways and alternatives for those treatments.
What got you into this? I call it a niche. What got you into this specific niche of really wanting to focus on honing in on helping people get out of pain?
Well, so like I said, I'm like very active growing up. So classic story, I tore my ACL during college and tennis, and went through rehab, and it was just kind of detrimental in my life. It
Yeah.
sounds so minor, right, when you say that, but going through the rehabilitation and getting back to life was such a important focus, and having the right team around me and healthcare professionals to get me back there was vital. So that was part of it. So I do love musculoskeletal medicine, neurologic, like the nervous system.
hmm
And so from a system standpoint, I really like this specialty. And I chose physical medicine and rehabilitation because it fits all those things. Because we don't have a specific body part, as we call ourselves physiatrists. We treat function, just like I said. So we find ways from a medical standpoint with medications and therapy to help patients, and interventions to help patients get back to living their life. And so I like pain, interventional pain specifically as a subspecialty, because I have a lot of tools in my toolbox to help patients get to that point. Like, it's tangible changes that you can see immediately after you give them something. So it's really rewarding. And I get to do surgeries as well, which I love to use my hands. I like to say I have good hands, gentle hands, to incorporate that and continue care with patients throughout their journeys is rewarding. So that's why I chose this specialty.
That's pretty awesome. Was there anybody in your family that maybe was doing something into regenerative, or that are doctors or nurses that maybe I'm just trying to find you know, oh, I want to do that or something like that?
There are no doctors or people in medical in my family.
Okay.
My siblings are like finance, business, things like that. And I'm not like, I didn't grow up in a typical Asian household where, you know, the mom and dad are like, you need to be a doctor, a lawyer. It was nothing like that. I just always had this, I don't even know. It's just something that I've always knew. That sounds so cliche, but I've always knew I wanted to be a doctor of some sort. And then finding the specialty was something that you figure out later in medical school and beyond. So,
Okay. Okay. Well, some people, they're like, yeah, my mother was a nurse, or my
well,
somebody.
we have dentists in my family, but we don't have any
Okay. We're getting
doctors.
closer. We're getting closer.
Yeah.
So would you say right now, like just starting your new company, and you're basically, this is entrepreneurship 101.
hmm
Would you say it's been pretty hard or difficult, or how's that transitioning from, probably working for somebody and now you're basically working for yourself? I mean, that's not an easy thing.
Yeah, no, this is, and I try to give my story on my social media handles and things, because I learn a lot along the way. You know, I will say there is a cookbook way of starting up practice, right? Like, you know, it's been done for, decades. And so, but, my experience in the real world also really helped me hone in on how I wanted to do things. And in today's world, we have the luxury of having AI. So if I have a question, I
Oh
just
boy.
ask. And you can't always trust it, obviously, you have to double check, but it really does help you prevent yourself from having to find a consultant to find a simple answer, like, how do I make an LLC? Like, like that kind of thing. Or
Oh, yeah. The right way, not the long way.
what do you suggest for me to do my bookkeeping? Like, how can I keep my costs low? Like, and then you can also compare. There's so many different things you can do. So being an entrepreneur in healthcare as a physician owner is difficult because, well, we already know how to take care of patients from a clinical standpoint, but then you have to be able to form a healthcare system that's essentially from scratch, unless you are inheriting a practice or something from an existing place. But there are challenges with that too, because then you have to, I kind of like starting from a clean slate and making sure all the processes are, very streamlined and good, because I've seen the chaos that happens if there are not protocols in place for things from a clinical workflow standpoint. And I just want to avoid that at all costs and make work not as stressful as it can be, especially with, cutting reimbursements with insurance.
Mm.
Physicians are getting, like, they're getting told to see XYZ number of patients. And when the patient only gets 5 minutes with the doctor, and then so I don't like that. I want it to be not a factory. I want it to be like your mom and pop that you always think of when you're growing up with the doctor in their suitcase coming to your, that kind of thing.
Nice. So maybe tell us a little bit about yourself, married, kids, or
Yeah, I'm married. I don't have kids, but I'm hoping that will be something soon. I'm not getting any younger, but
none of us are. I'm right
and then
behind you.
my friends are like, "Are you sure you want to start this practice and have a baby at the same time?" And that's another aspect too, is being a female in medicine is comes with its own challenges. Obviously, you have to carry the child, but you just figure it out. You find somebody. I already, once this does happen, I will find somebody to help cover during that time. And my patients, I'm sure, will be hopefully happy for me that I'm growing my family, and they'll be like, "Okay, Dr. Chu's gonna be back, in a few weeks or whatever." Um, you just figure it out. And how many kids do you have, Mark?
I have two boys. I have a 19-year-old and a 16-year-old. And when they're
Yeah,
19, they're still a kid. Let me tell you.
yeah. I mean, everyone says there's never a good time, and I truly believe that.
I agree.
So, and then I have a twin sister who has two little ones, and then my brother has three little ones. So I know the chaos that happens when they're from 0 to 6. So yeah, it's something that I'm striving for. It's hard to do everything at once, right? Be a good wife, be a good mother, be a good business owner, be a good physician. And I've been told, you can't be good at all three. They say you have to kind of, you know, but that's the other beauty of entrepreneurship.
Balancing.
I have the power to lessen my schedule if I need to,
Yep.
and the flexibility, like, it's okay. I'm not going to make as much money or whatever, but, you know, I like that autonomy. So that's the other reason I chose this route.
I think that it's about the love for it. It doesn't matter how much money you make. If you don't like doing what you do, then it
Definitely
doesn't.
not about the money, that's for sure.
No, I love it. So what was the big push on why you chose interventional pain medicine? And if you can maybe talk a little bit about that.
Well, when I was in medical school, third year is when you kind of go through your clinical rotations. So I kept a very open mind. So I was like, I'm gonna, and my first rotation was surgery, general surgery.
Mm.
That was a wake up call. But I was in the OR with the surgeon, and I was lucky enough to be one-on-one with an attending. Typically,
Wow.
oftentimes you're just part of this group of medical students sitting in the corner of an OR, trying not to get anything unsterilized and just mind your own business. But I was able to be a first assist in his, like, cholecystectomy cases, things like that. And I'll remember this, like, I still remember this to this day, but near the end of my rotation, I was closing his trocar openings, suturing, and he told me, he said, "You have the best hands I've seen in a long time."
Oh, wow.
Yeah. And I was like, "Oh, I appreciate that." And then as I progressed in my training, I would get some feedback from attendings, like, "You have good skills with your hands, like, you're good at holding the ultrasound," like, whatever, those kind of things. But so I always knew that I wanted to do something procedurally with my hands.
Hmm.
I were in clinic all day, like, as a psychiatrist, talking to somebody for hours, I definitely could not do that. So I was like, "Okay, I wanna find something that I can see patients, but also have time to, like, do procedures or surgeries." And so this interventional pain is exactly that. we find ways to help people with their pain by avoiding too many medications. I know that's one of the myths. It's like you're a pain doctor, you prescribe, Norco and stuff like that. So that's far from what we want to do. At least a good pain doctor wants. We want to find ways to minimize the medications, give you some, low procedures that can help you rehab and get back to living. So at one point I was like, oh, maybe OBGYN. And then they do surgeries and they see patients in the clinic. It wasn't my thing. Neither was the culture of just that field in general for me. So, and people in physical medicine rehab are fantastic. So I had an older colleague that was, 3-4 years above me, and he had mentioned, you should think about, PM&R. That's what we call it. I was like, okay, what is that? I was like, I know what orthopedics is, but what's PM&R? Now it's become, it was a secret before, but now it's become such a competitive and popular specialty for medical doctors. But, PM&R, like I said, we focus on function, but we treat all disabilities from a sports injury, like to a rotator cuff tear, all the way to that has something more severe, like a traumatic brain injury, a spinal cord injury, or stroke. So we can work in many different settings, more of a general view. And I'm just kind of a straight and narrow. I go for it.
Okay. I like this track.
Well, the mission is truly to, have a place where you would want to take your family member to, because I really want it to be personalized, direct care. When it becomes a bigger practice or corporation, I've seen this in my, time being employed, where a patient would be seen by a doctor and then they would be thrown around different providers. There was no continuity or ownership of their care. And so that's huge for me, is to be able to directly take care of the patients throughout their treatment. I really want to start with the most conservative thing and move on from there. And there are a lot of interventions that we can do. We'll get into that at some point. But like I said, it's truly about having that ethical, personalized care. That's the mission of Artisan.
Mm-hmm.
And then as far as depends on the type of pain that you have. So, I mean, the one that you can probably most relate to is any musculoskeletal.
Okay.
So, when you, like I said, it's torn rotator cuff and hurt your knee and missed your. Those are things where we can involve. Steroids are pretty common, but too many steroid and injections can be bad for the joint. From a patient perspective, if I were to get an injection somewhere, I would prefer to do something more regenerative and not like destroying. So cortisone is very effective, and it can last for a few months and gives you great relief for you to do your. And that's sometimes the easiest and best thing to just do. Like, especially just the first time, like, hey, let's give you the shot, go to therapy, and let me see how you feel in, 2 to 3 months. And then, but like I said, we have things like PR and other treatments in the regenerative medicine field. I'm going to start with the PRP, but then there's a lot of things like aspirate constipation and things like that, protein constipation. But then we also have a shockwave machine as well. That can be a really great treatment for musculoskeletal. If your pain is, like I said, like the Medicare patients that are with all arthritis and things like that, again, those regenerative things can be helpful, but those are cash-based. But we have things like radio frequency ablation. It's a way for us to burn nerves, but then the pain signals coming from the arthritis in different areas.
Mm-hmm.
It's most common, low back.
Yeah.
And so that's covered by insurance. That's a pretty common thing. And then if your pain is from a neuropathic standpoint from the nerves, we have a whole umbrella term of interventions under the umbrella term of neuromodulation. Neuromodulation is when we use electricity and wires to stimulate areas of the body to cover the pain. And it really does. There's a lot of great evidence behind different types of neuromodulation. The most common one that's been around the longest, I would say, is spinal cord stimulation. Are you familiar with that?
Oh, yeah.
You are? Okay.
Mm-hmm. Yeah, well, let's talk about what that is for the audience that maybe doesn't really know what that is.
Yeah, I mean, spinal cord stimulation is where we take a couple of wires, like as thick as the tip of a pen, and we place them in the spine, behind the spinal cord, underneath the roof of the spine, in the epidural space. And then those wires are attached to a small battery. The battery is like a pacemaker battery.
Yeah.
It's a thin battery, and it goes underneath the skin in the back. And that sends stimulation and modulates the pain signals. And it's really good for neuropathic pain, especially. So pain that people have in the back after they've had surgery, or pain down the leg. It can also be treated up to the neck to treat the arm and the shoulders as well. And then from the spinal cord, you can go outward to the peripheral nervous system and also do wires in those areas too. It's with a similar idea of having a battery. So, as you go outward, there's something called the DRG, or dorsal root ganglion. And then as you go from the DRG, you go to the spinal nerves, and you can go somewhere as far as even, your armpit or your elbow to reach very, very specific areas. So the peripheral nervous system, you can also put a stimulator as well, a peripheral nerve stimulator. And that's a lot less invasive as well. So that is one umbrella that is what we're trained in doing, interventional pain.
Oh, wow. When did the light turn on for you? I know you hit a little bit on it, but when you were like, at that moment, when you're like, I want to do this, this is what I want to do. Like right when that light turned on, I know you know when that was, because we all know when that light turned on. We're like, I'm doing this. I'm ready to rock and roll. I got the gas and the fuel. Let's do it.
Well, I want to give a big shout out to one of my mentors, Dr. Omar Salab. He is a physiatrist in the Fort Worth area. And he was my introduction to the specialty in medical school.
Mm-hmm.
A light bulb moment happened after that one when I also rotated with a PM&R pain doctor on the side. He's not a pain doctor, but this other one was. Her name is Dr. Fox. And I shadowed her and I saw what she was doing and I was like, I know I can do this. And so that was when I saw her and when I saw a patient get up and was like, so like tears in their eyes that they were, their pain was better. I mean, and that was the light bulb when I knew that I wanted to do it. And then
That's
when
awesome.
I did it in a patient and when they walk out with that relief immediately, it's really, invaluable. I mean,
So
that's
basically, when you got your own tears, you're like, okay, we're ready to go. Yeah. I got the first tears,
you
but
don't
when I
need
got the
tears.
second,
That's fine.
no,
Yeah.
I'm saying like it's what I'm saying is that you're speaking of something that's becoming a disconnection these days. And what I mean by that is the heart, the
Yeah.
emotion. We've got
No,
AI, we've
truly.
got robots, we've all watched the Terminator. So we know what happens at the end. Let's be real. We'll be long gone before then. So that, the kids can take care of that. But I'm just saying it's the emotion. It's the way we were created to help people and it's being selfless. And I just think that it's something that's very powerful, which it's becoming more and more rare. I know it sounds weird saying it, but it really is. And speaking of isms, you mentioned shockwave. What does shockwave do? I know it does, but I know it's phenomenal because I've tried it. I recommend it to everyone that's listening to the show. Now, before Dr. Cindy talks about it, what I will say, if you're in pain, I don't care if you got back pain, neck pain, stiff pain, you've had pain for years. I had back pain from a slip disc years ago. And this pain would come every once in a blue moon, whether it inflamed by stress or too much going on in my life or maybe just some stinking thinking. But I tried it and I would say within 4 minutes, I was out of pain. And if you're in a lot of pain, I would totally recommend it. So I don't want to ruin it for you, but yeah, tell us a little about this shockwave on some of the treatments that you've maybe seen happen with people and what it does.
Yeah. I mean, to be honest, it's not something that I was exposed to in training, but I am a big believer in regenerative medicine. And there's still a lot that we need to do in terms of research and literature. But the basic premise behind shockwave is using strong electrohydraulic forces to get deep into the tissue and tendons to help regenerate, bring more blood flow, but also help regenerate. They say something. It's called something called a cellular response technology, where the cells start to regenerate, and people get results immediately, just like what you were saying, Mark, within minutes of treatment. And then
Unbelievable.
yeah, the recommendation is that you go through a series of treatments to get the full benefit. At our practice, we're going to offer a package of 10 treatments after the initial for patients to pick to choose to do once they see how
You're going to want
beneficial.
it.
And I'm going to try it on myself once I get in the machine to give true like personal results, just like you have, Mark. I have had knee problems and I get plantar fasciitis from when I play too much. So definitely want to try it on those things. But it really can treat any musculoskeletal issue. And like I said, it's conservative compared to sticking a needle in someone. And then that in combination with putting in like something like PRP can
Mm-hmm.
be even more beneficial because you're putting the gold in there. And sometimes you might want to do subway first to help calm the acute inflammation down because putting in the platelet-rich plasma, which is going to take your own blood and centrifuge it and then put the platelets in your around your tendons or in joints. It can be a little bit inflammatory, and that's the whole point of it to bring all those, inflammatory regenerative cells there. But it can cause an acute kind of worsening of pain before it starts getting better. And so, depending on the situation of the patient, we may recommend the shockwave first, see how that goes, and then we can also add in that even more regenerative medicine in the area. So, hope that
I
answers.
like that. I know it answers a lot. For those that out there that don't know what PRP is, maybe you can kind of explain not just what it is, but what does it actually do?
Yeah, so PRP is platelet-rich plasma. It's where we again take your blood and centrifuge it, and then we just take the plasma part of the blood, and then all of that helps bring in. I'm not like a scientist, but it brings in all of these like ligands and different regenerative properties and cytokines basically into the area, and over time you will start feeling great relief. I have a couple of friends that I've referred to my sports medicine colleague in town, and they swore by it. His elbow, and put it his ankle. He feels 100% better. This is like 6 months later. He was back to 100%. So it takes a little bit of time, but it definitely can help you prevent having to get that major surgery. That's what it's all about. Avoiding that big surgery, if at all possible, then I'm all about it. And to me, taking away pain by destroying nerves is probably worse than bringing in something to help use your own body's cells to help regenerate the area.
No, definitely. Those of you that have played pickleball or tennis or any type of sports, and I'm going to say this, a lot of the NBA and even professional football teams are utilizing shockwave like right
Yes.
away.
Hmm.
You'll see people nowadays where they get an injury, they're out for the rest of the quarter. And now they'll take a 15, 20-minute break, go in there, use a little bit of that shockwave, and they're back out there. So if those of you like myself, pickleball arm, tennis elbow, that will work great because it starts to stimulate, gets that blood moving. So when you're in pain, everyone, correct me if I'm wrong, doctor, when you're in pain, it's because it's inflamed. And so when it's inflamed, what happens is the blood is moving very slow instead of moving fast, which the way it should be. And so once you've got that blood flow, what happens is you're able to start the healing process. And I know for a fact with tennis elbow, it helps. And I've had my share of tennis elbow. It doesn't feel too good.
No, yeah, no,
Yeah.
yeah, exactly right. So, like I said, it can't hurt. It can't hurt you. It can only help you. And the success rate of the shockwave treatment is it's phenomenal. At least both of
Yeah.
them. I would love to give more personal anecdotes as my practice grows and we get more patients in there. So we can always touch base again, Mark, with the
We will. No, we will. With this, it'll be a
yeah,
continuation. You'll have
yeah,
that board. You'll have the board art behind you. It'll be up.
yeah.
So you're going to be opening, Lord willing, in October, and right now you're getting all the situation going on with landlord probably and getting everything walls up and down. I'm sure.
Yeah, I mean, the things that I'm currently working on right now, I don't know if this is a detail that anyone cares to know about, but from the entrepreneurial standpoint, I've been trying to configure my electronic medical record because, as you know, when a doctor sees you, they can't just, they have to put a note in the EMR, and then that note gets sent and coded. It gets sent to the insurance company. The insurance company decides if they're going to pay you. You don't get paid on whatever you did for 2-3 months. So it's very important from the front end, if you were starting a practice, to make sure that your workflows, but like I said, the electronic medical record is configured in a way that you can make sure that all of this is done correctly, or how you view the way that you want to be able to view it when you're doing these things. So that's one thing I've been working on. It's been a huge thing. The second thing is getting the IT infrastructure in my office. I had several meetings with different IT companies. And then I just talked to the cabling guy this morning to get the cabling in. We have that figured out, but everything costs a lot of money. So it's like, should I buy this equipment and
Mm-hmm.
give it to you? And then as far as construction, we have the framing in on my office, but it's all open. The drywall's not in yet. But they are going to put lead lining and all that for my x-ray room, because I do a lot of my procedures with x-ray guidance as well as ultrasound. So, we're waiting on the construction from that piece. The landlord is also talking to me about what I want for my signage, things like that for my door. Those are fun things. And then on top of all that, it's important that you market yourself and meet people in the area. So I've been going to dinners and breakfast, lunch, and dinner these days, meet with different referring doctors and things like that. Because when you're a specialist, you do need a referral typically if the patient needs to be
100%.
seen. So yeah, and then credentialing with payers takes months. So I finally got two big ones, but still waiting on a lot of part of and network with. So all a lot of work, but it's not very fun, but it's necessary. And then I've hired my first three staff members.
Wow.
We had a meet and greet this week on over video. But aside from taking care of patients, I truly want to make a work environment where we all respect each other, and we're all open to any new ideas, especially being a startup. There's going to be
Growing as a team.
Yeah, growing as a team. Yeah,
That's awesome. So what would you say? I know that we're about to end this on where we're going right now, but what would you say, like right now? Would you say that this is one of the hardest things that you've done? Or would you say maybe it's kind of close to maybe going to school? Or is it like, do you feel like you're still in school in a way,
That's a good question. I'm a go-getter, and I feel like you are the same way, Mark. So it's like, I don't know. There's nothing, I truly believe there's nothing that you set your mind to that you can't do. And so one of my greatest joys is when somebody doubts me and then I prove them wrong. So
I'm the same way.
So
the competitiveness, the tennis coming out of you. See, you can't get that out of you.
No, and that's another reason, like, I want to grow up my kids up in sports. It's important because you learn these kind of values. Anyway, all that being said, yes, this has been quite like I said, I'm a clinician. I'm not a business person, but I am now. Just I'm learning along the way, and I want others to learn from what I'm doing. And the way I do something may not be right, but they call it the practice of medicine, but I think it's the practice of business too. And with all that being said, it's going back to the real mission is to be a good doctor, be a good person, and be a good person, not a coworker, but a good business person. The fact that in good faith that you're going to provide care, that you're going to follow up with people, because unfortunately in today's, there are a lot of, bad apples out there, not because they want to be, it may be because they're just not capable or they don't have the systems in place, but again, I don't want to say you need this injection or whatever, you need this procedure just because I need to make money off of your visit.
I love it.
That's not at all my mission. It's if you don't need anything and you just want an explanation of what is going on and how we can do it with just therapy, that's fine. I really want to be an honest, person in the field and to patients so they can trust that I'm treating you like family, so.
Oh, I can tell you're going to do fantastic. I mean, of course I'm biased because, I used to be a tennis pro. I used to teach professionally over at San Jose Swim and Rec Club up in San Jose, then at Pebble Beach. So, I know that competitive streak, and that's good, guys, because think about it, ladies and gentlemen, when you have someone that's in sports minded, when they see you, they look at it like, we're going to get you better, and we're going to try every way that we can to get you better. And if they can't, the cool thing is I can tell Dr. Cindy will do this too. I know someone that will, or I know someone that can, and that's why we need to work together as a community, as a team, and realize that we're all on the same team. Sometimes, we've got politics. It's like, there's no team anywhere. We're like, you guys are jacked. It's like, can we all just get along? I mean, come on, we're like in this together. Nobody's going to remember anything in 70 years from now.
Right,
you know,
exactly.
I mean, our luck, Cindy, we'll probably be here till about 180 because you've got, Elon Musk creating things that are just, we never thought he would do or we would see in our lifetime. But what I will say, guys and gals out there, you can find Dr. Cindy too at artisanpain.com, artisanpain.com in Plano, Texas. In Plano, Texas, what are some of the surrounding areas that you're looking at? Would you maybe see that you're people coming in from in those
Yeah.
surrounding
Oh, yeah.
areas?
So Plano is just north of Dallas. So, North Dallas, and then I'll cover Plano, Frisco, as Salina, and McKinney. So all of the North Dallas cities. I mean, really, I've had patients that I've seen in other places and cities that are willing to even travel to come see me. So, I think it is actually hard to find a physician that you connect with. And if you find something like that, then, even I personally would travel to go see them because I know I'm going to get good care and it's worth it. So I think that patients are willing to travel if they know they're going to get good care.
It's the truth.
We'll take care of you if you want to come.
It's funny you say that. I'll use that as an example. So I'm 49, going to be 50 August 2nd. I'm like, wow, 5. Wow. I'm hanging on to those 40s.
No, you don't look like.
Yeah, thank you so much. And so it's all aloe vera. I'm just joking. But I travel for my eyes to Portland, Oregon, all the way from California. And I'll tell you why. The physician, she's phenomenal. I connect with her. I relate with her. So that's what I love with you, Dr. Cindy. So if people want to do a phone call or even a FaceTime, get to know her. I'm sure they can give you a call. And then, you know what? It really doesn't matter. If you can get somebody out of pain working better, I'll fly anywhere. I don't even care where it is. Go ahead, take a little vacation while you're getting out of pain.
Yeah. I mean, I say that not just as for doctors, but like for my hairdresser, like I've seen him since college. And then when I moved out, whenever I came back to town, I would still it's the same kind of thing. Like,
no, 100%. I'm with you, and I'm excited, Dr. Cindy, for what you're doing. I know you're going to do amazing. I can feel your heartbeat and your passion with what you're doing, and I can't wait till we get everything set up because I'm going to have you back on. We're going to do a before and after, and we'll have testimonials. I'm sure she'll have a bunch of video testimonials of people before and after pain, and especially remember, guys, watch out for that shockwave, man. It's especially if you have like diabetes and stuff like that. I know for a fact that it helps people relieve that pain. And then with consistency, I'll let you in on a little secret, everyone. Get the package. That's all I got to say. Anyway, thank you so much, Dr. Cindy. You've been a blessing.
I just want to say, if you want to follow my entrepreneurial journey, I have an Instagram called Dr. Cindy2, dr.cindytiu. They're very candid videos of random things I've learned or whatever, even walkthroughs of the build out, things like that. So if you're interested in that part, you can follow me in that aspect.
Oh yeah, I've been following you, and everyone, make sure you follow her. I'll make sure the link's there.
Okay, I appreciate it.
Thank you so much.
Thanks for having me.